Nearly 200 people die from opioid overdoses every day in the U.S. As a former opioid addict, which lasted about 10 years, I am very grateful to be speaking to you today. What most people don't realize is that addicts want an opportunity to turn their lives around, even if they refuse to admit it. Unfortunately, when they are forced to make hard decisions in their lives about their sobriety, it is often under pressure, such as an arrest for possession. Under current U.S. drug policies, the opioid addiction crisis in the U.S. has flourished. Despite the threat of harsh legal and financial consequences, more and more Americans become addicted to opioids every day. As country of law and order, Americans expect that those who break the law will face appropriate consequences. Because incarceration is not a solution to fighting opioid addiction, it should be replaced and/or supplemented with treatment. Most Americans find themselves addicted to opioids due to a car accident or a work-related injury. Whatever the true cause may have been that brought this on our country, we owe it to our citizens to identify solutions. According to the NIH Principles of Drug Abuse Treatment for Criminal Justice Populations Research Guide, not only does comprehensive treatment work, but it also reduces drug abuse and the likelihood of becoming a repeat offender. Outcomes can be improved when criminal justice personnel work in tandem with treatment providers. Estimates from the Weighted National Survey on Drug Use and Health suggest that there were 91.8 million people, or roughly 1/3 of the U.S., that used prescription opioids in 2016. The President's Commission on Combating Drug Addiction and the Opioid Crisis described the death toll resulting from the opioid crisis as akin to terrorism. Our people are dying. More than 175 lives lost every day. If a terrorist organization was killing 175 Americans a day on American soil, what would we do to stop them? We would do anything and everything. We must do the same to stop the dying caused from within. We know that a substantial subset of the prison population in the U.S. is incarcerated in large part due to drug-related offenses. Because of this, the President's Commission found that it is a matter of public health and safety to make drug abuse treatment a key component of the criminal justice system. A more effective and proactive alternative would be offender placement in a treatment facility. Some people think that if you break the law, no matter what, you have to serve your time. In jail, not in a hospital. The primary intent of incarceration is to keep violent offenders and those that cause harm to others out of society. Addiction cannot be addressed by being locked away in a cell. It requires medical attention and counseling. This would be successful delivered through an alternative treatment options. People think that because of the cost of healthcare in the U.S., providing treatment to addicts will be too much of a burden on taxpayers. According to the Partnership for Drug-Free Kids, treatment options in place of incarceration would save American taxpayers and the system billions of dollars. Most people familiar with how addiction works know that addicts cannot be reasoned with. Their disease controls their decision-making skills. Just because you put an addict in treatment doesn't mean they will be open to accepting it. It is true you cannot make an addict seek out and embrace sobriety. However, because most addicts want an opportunity to get clean, the likelihood of success is much greater. In order to provide support and resources to aid addicts in their journey to sobriety, the solution must integrate intensive treatment options for opioid addicts. Effective interventions include therapeutic alternatives to incarceration, treatment merged with judicial oversight in drug courts, prison and jail-based treatments, and re-entry programs into the civilization. Through monitoring, supervision, and threat of legal sanctions, The justice system can provide leverage to encourage drug abusers to enter and remain in treatment. According to Alex Acosta, U.S. Secretary of Labor, the gold standard is use of medication in combination with ongoing behavioral therapy, also known as medicated assisted treatment. Comprehensive treatment should also include efforts to enable these individuals to rejoin the workforce. There is a strong evidence that says long-term recovery can be obtained in job. There are multiple benefits to providing intensive treatment for opioid addiction in place of supplement of incarceration. First, the likelihood of success of addiction treatment alternatives is much higher than incarceration, which has little to no chance for success. Offering treatment would support the efforts of the court system to keep families together. Second, offenders would be far less likely to violate probationary period due to missing appointments with probation officers and failing weekly urine tests, unpaid fines and fees. Lastly, Acosta also confirms that the solution saves money. Treatment options in place of incarceration would save American taxpayers and the system billions of dollars. Collaboration between federal, state, and local criminal justice systems, as well as healthcare, workforce, and education partners, will produce a comprehensive model for fighting the opioid crisis. This can be done by block grant federal funding, remove reimbursement and policy barriers, and using medication-assisted treatment with pretrial detainees and continue treatment upon release. As a recovered opioid addict, I can attest that overcoming this addiction is the most challenging experience I have ever faced. As law enforcement officials and policymakers, your role in this effort can help save millions of lives.